Anti-fungals, ladies and gents. High-yield concepts in pharmacology. Welcome to ATC Medics. Thank you for watching. Don't forget to like, share, and subscribe. So we're going to go through the following antifungals: clotrimazole, ketoconazole, iconazole, itraconazole, voriconazole, and fluconazole, as well as caspofungin, terbinafine, amphotericin, nystatin, and flucytosine. I'm going to then follow up with some memory aids, how to best remember these medications, their mechanism of actions, or other important information. And then I'm going to help you to understand how to delineate antihelminths and PPIs from antifungals as per their names. So without further ado, the first of the antifungals is amphotericin B. This is a terrible drug. It is a polyene antifungal. It is used for the treatment of systemic infections. The important things for this is that it can cross across the blood-brain barrier, and therefore it would make sense that it is used as first-line treatment for cryptococcal meningitis. Again, meningitis being inflammation of the meninges. How does it work? Well, what it does is it binds to ergosterol. Ergosterol is part of the cell wall in your fungi and therefore creates pores. By creating pores, what happens is that it'll allow leakage of the intracellular components, thus destroying the fungus. The adverse effects that we absolutely need to know about is this concept of shakes and bakes. It can lead to the patient suffering from what might otherwise be described as chilton rigors, significantly elevated temperature fevers, with then rigors of shivering. It can also, of course, cause electrolyte imbalance. If you think about this, we're going to cause leakage of the intracellular components and therefore disrupt our user needs, our electrolytes. Next in line, we have the nucleoside analog flucytosine. Flucytosine, if you look at the name, cytosine, you may well recall coming across your bases in DNA, A, T, C, and G, and here you've got cytosine, and what happens to flucytosine is it becomes 5-fluorouracil, thanks to the enzyme cytosine deaminase. Now, 5-fluorouracil, again, uracil is that fifth base found in RNA, not DNA, and 5-fluorouracil will inhibit the synthesis of this genetic material. We then have the third of the agents, again, another polyene antifungal, nystatin. Nystatin works in exactly the same way as amphotericin. The fourth of the agents is terbinafine. Terbinafine essentially will prevent the formation of ergosterol. Again, as mentioned, ergosterol is part of the cell membrane itself, but the step in which this intercedes is the transformation or the conversion of squalene to lanosterol. So it inhibits squalene being converted to lanosterol and ultimately ergosterol. That's your terbinafine. We then have itraconazole, voriconazole, and fluconazole. These are collectively known as triazoles. So triazoles are your itraconazole, voriconazole, fluconazole. Voriconazole is a first-line treatment for aspergillus infections in patients with tuberculosis or COPD. Fluconazole is another agent similar to amphotericin B, as we mentioned earlier, that can cross the blood-brain barrier. And again, because it can cross the blood-brain barrier, it can then be used for the treatment of cryptococcal meningitis. Fluconazole is the second-line treatment for the treatment of cryptococcal meningitis, amphotericin B being the first line. We then have the three agents, clotrimazole, ketoconazole, and miconazole. These collectively are known as imidazoles. And the important thing here is that clotrimazole is a topical agent and it is used in the treatment of dermaphyte infection. And finally, for this part, we have the echinocandin caspofungin. Now, caspofungin also works on the cell wall, similar to your terbinafine, except terbinafine, as we said earlier, prevents the formation of ergosterol. whereas caspofungin inhibits 1,3-glycan synthase, a transmembrane protein. Caspofungin is administered via the intravenous route, and it is used for the treatment of aspergillus and candidiasis. So moving swiftly on to the memory aids, how are we going to remember some of these medications and what they do? So we'll start with amphotericin B. Amphoter is terrible and it's going to tear a hole in the membrane. And again, we can then appreciate why and how it's going to cause leakage of the intracellular components. Flucytosine, second in line, is going to cause the cytosine is going to be converted to 5-fluorouracil. Both of these are bases found in genetic material, and therefore they're going to prevent the synthesis of RNA and or DNA. Terbinafine, this is used at the start. It prevents the first step right at the start of the whole cascade of events in the formation of ergosterol. So S for squalene, S for start, and T for terbinafine. S and T make up the first two letters of start. So that's how you know it's the first step, and it's a squalene terbinafine start. Your triazoles, try, as in let's try something, try IVF. So itraconazole, voriconazole, and F for fluconazole. Now, the other thing with voriconazole is one of the side effects. Voriconazole can cause blurring of the vision. And so we have the concept of varifocal glasses, vorifocals, voriconazole, blurred vision. We then have imidazoles, and the imidazoles are your clotrimazole, ketoconazole, and miconazole. And here we have CKM, if you remember from your lectures with Dr. O'Connor, or otherwise when you look at some of the content. CKMB is one of the blood tests we perform, so that's what you can remember here. It's nothing to do, the blood test has nothing to do with antifungals and the agents that we're using here. However, it can be used as a memory aid. CKM for imidazoles. Finally, we have caspofungin, Casper. Casper is Casper the Friendly Ghost. What it does is very quietly decrease the cell wall integrity, kind of disappearance of the cell wall because it's no longer working, it's no longer functioning the same way. So Casper the Friendly Ghost, Casper, cell wall integrity, 1,3-glycan synthase. And to finish things off, I said I was going to help you to delineate antihelminths from antifungals and PPIs. So your antihelminths, mebendazole, levimazole, ivermectin, piperazine, and praziquantel. All of these guys have a hole or bend in them, whereas your antifungals all in azole. So with the exception of mebendazole, again, it's got the bending, and levimazole, and there's an agent for that, levimiarsole, but you'll learn about that in the anti-helminths lecture, which I've done as to how to remember that and how it works. So there's your agents over here, whereas your PPIs, you've got your omeprazole, lansoprazole, pantoprazole, and esomeprazole. These guys are razoles as compared to azoles for the antifungals. And there we have it. I hope you found that helpful. I hope the memory aids were useful and that you'll find them beneficial to consolidate your learning. Don't forget to review my other videos on antihelminths, PPIs, and of course the other content in preparation for your exams.